Hello, my name is Michael Waterman, and I did my final project on seasonal depression. Seasonal depression is a mood disorder characterized by depression that occurs at the same time every year. It is commonly referred to as SAD. It is triggered by the change of seasons and most commonly begins in late fall and lasts throughout the winter. Patients usually experience remission in the summer months. People may experience anxiety, loneliness, loss of interest, mood swings, and sadness. Seasonal depression is categorized by the Diagnostic and Statistic Manual of Mental Health Disorders as a type of depression, but is no longer considered a discrete diagnostic entity. It is categorized as major depression disorder with season patterns. The cause or influence of seasonal depression is the reduced level of sunlight in the fall and winter. A drop in serotonin, a brain chemical that affects mood, will play a huge role in seasonal depression. The change in seasons can disrupt the balance of the body's level of melatonin, which will play a role in the sleep patterns and moods of one. Seasonal depression can make one physically ill. If you spend all your time cooped up in bed, it can take a toll on your hygiene. It can give you a lack of energy. You can also have weight gain and have a lot of oversleeping. Cause you to be sad and feel lonely almost all the time, plays a big toll on your mental health, and makes it feel like normal day activities aren't worth it. This depression can completely change your personality traits. You can go from fun, outgoing, and or loving to unhappy, reclusive, and or down on yourself in a matter of days. Not many people have seasonal depression. They say about 0.5 to 3% of the population experience seasonal depression. 4 out of 5 people who get this depression are women. Typically, the further one is from the equator, the more at risk they are for seasonal depression. Some treatments one could foresee would be self-care and trying to surround yourself with people who want to help you and be there for you. If it gets bad enough, you could also see a doctor or a therapist to help you with getting out of this depressed mental state. Another treatment, you could use the medication by taking antidepressants that can help relieve symptoms of depression or take away any chronic pain you might have. When talking about seasonal depression, the risk of having it gets higher as you get older. It is rare for individuals under 20 to get it. The symptoms usually start anywhere between ages 18 to 30 and are usually the same thing when it comes to age. It doesn't really matter how old or young you are when you get it. You could have the same, worse, or even better symptoms compared to someone who is older. It just depends on the person. The study was done by Issues in Mental Health Nursing. The abstract is as following. The article discusses a research study on seasonal affective disorder, SAD, according to the Diagnostic and Statistical Manual of Mental Disorders, is considered as a subtype or pattern specifier of major depressive disorder, recurrent with seasonal pattern. That data from 30 studies were analyzed on SAD rates in 17 countries using the seasonal pattern assessment questionnaire. Findings indicate the influence of culture on SAD. Seasonal depression was founded by Norman Rosenthal in 1984. Modern-day psychologists focus on behavioral talk theory and light therapy to help. When you go to therapy for seasonal depression, the main goal is to expose people to a bright light every day to make up for the diminished natural sunlight in the darker months. For this treatment, the individual sits in front of a very bright light box every day for about 30 to 45 minutes, usually first thing in the morning from fall to spring. Patients can also enroll in regular talk therapy as well to help combat seasonal depression. In order for patients to fully benefit, therapists must possess these things. They need to be excellent communication skills, they need to be patient, and they need to be trustworthy. Patience is a big component to being a good therapist because the individual should feel comfortable talking to you without getting any type of backlash. They also need to feel trustworthy. When getting very personal and saying things you wouldn't want to say to anybody else, the patient needs to make sure they can trust them. I believe individuals with the disorder will benefit from this therapy because they can bring more light into their lives every morning, which can help them combat season depression. They also can have a therapist they can talk to and connect with people and find ways to manage their disorder. The treatment is the same for all ages when it comes to this depression. They do the same types of tests and would treat you the same way no matter your age. And treatment research study. The article reports on a research study that sought to find the better treatment for seasonal affective disorder between fluoxetine and light therapy. The authors wanted to compare the two therapies. They conducted a randomized controlled trial of 96 adults that had moderate or severe depression with seasonal affective disorder and were not treated.